Well, I'm super excited to talk about this topic because it's something I'm really passionate about. So I just want everybody else to know about that. It's the best thing. I've been a holistic physical therapist for over 30 years now,
Mhm.
and I specialize in myofascial release, craniosacral therapy, neurokinetic therapy, and multiple holistic therapies. And I mainly work with women over 40 who a lot of times I'm their last stop. They've tried a lot of different things between holistic things and traditional physical therapy, chiropractic, etc. So I'm kind of like their last stop. And so most of my women, they want to get back to physical activity. They're very active. A lot of them are dealing with chronic pain, have had multiple surgeries. So in the last couple of years, I've incorporated the Dolphin. Incredibly. So I discovered the Dolphin from a colleague friend of mine who has a PT practice in Louisiana. And she said, you've got to add this to your practice. And it kind of went on the back burner for a year or so. And then I happened to be on Facebook and I saw Kelly Armstrong. She was going to do, one of your trainers, instructors, she was going to do a webinar on an intro course on the Dolphin. So I took that and I was really intrigued. And it was during the COVID time, so you weren't doing live classes. So I just started taking the scar tissue release course, the intro course, some other courses with Lane, your other instructor, on cervical spine, lumbar spine, and just started to develop in my practice. And I have to say the results that I'm getting are earth-shattering. By adding this, so just for an example, I can give you a case history. This, we'll call him Mark. He was a patient of mine in Naples, and he came in, he could barely walk. He had chronic back pain for 10 years. He was only 45 years old. And he tried traditional PT, multiple other therapies, and nothing really helped. And so one of the first questions I've learned by using the Dolphin is always in my history, have you had any surgeries? Do you have any scars? Whether that's broken bones or surgical scars. And he lifts up his shirt and said, well, I donated my kidney to my brother. And then I had a gallbladder surgery, what then went bad. And then I had this appendix thing, this other surgery. So I said, you know what? We're going to start right there. So we started with the scar tissue release. And in, I would say, 7 to 8 sessions, now this is a man who had 10 years of chronic pain. He had no pain, which enabled me to do more of, helping him get more core stability, helping him get more movement, doing the cranial work, doing the myofascial work. And really, he was done in 10 or 12 sessions. And so I recently talked to him. Now, this is 2 years ago, I saw him. And I recently gave him a ring and he said, you know what? I'm still feeling great. So it's not just treating symptoms here. We're getting to the root cause of the problem. And I believe from my PT experience, when you have a scar, it not only affects the fascia and changes things within the tissue, but it also causes our core not to fire up or function properly. So we could give someone a bunch of exercises, but if we don't address the core problem in the scar tissue, we've missed the mark. So I think this is really huge. And I've been doing a lot of scar tissue work. I could spend 3 hours right now telling you how many success stories I have. Super powerful. And I think we had this conversation a couple of weeks ago, Dr. Bruce, in regard to a blog that I recently wrote on the power of combining craniosacral therapy and the Dolphin stim with whether it's vagus nerve stimulation or scar tissue release. And I find that although I think craniosacral therapy by itself can be powerful, I think since I've added, I don't think I know since I've added this Dolphin Stim, that I am seeing quicker results and better results and longer term results. You know, sometimes when we treat, you know, especially if someone's been in the chronic stage, a lot of times it may take a while to kind of reset the nervous system. But what I find is when someone is having pain and they've been in this fight or flight, call it heightened sympathetic response, but I call it the deer in the headlights for our lay people. So it's like, we're like, whether it's from COVID, illness, chronic back pain for years and years, it's very hard to come out of that. And we can say to someone, oh, just relax, or, you know, get a massage. That doesn't cut it. We have to decrease that deer in the headlights, so to speak, before we can start doing the other things. And I feel like the vagus nerve stimulation with the craniosacral therapy, because the craniosacral therapy also addresses the central nervous system, those two are like the powerhouse together in getting results. It is the big ticket, without a doubt. And I just, you know, I just feel that it's just so powerful. And I had someone recently who, her history is she's a 72-year-old woman. She's had bilateral total hip replacement, one that went bad because during the surgery they broke her femur accidentally. And then she has rheumatoid arthritis, osteoarthritis, history of breast cancer, mastectomy, a lot of things went on. And what I did was I did the vagus nerve stimulation while I was doing the cranial work with her. And she just did so phenomenally. She had difficulty walking. Her gait pattern was way off. Her balance was off. And once we started doing that, her balance got better. We did cranial work. We did a lot of, we did scar tissue work as well. And she felt that she's done so many other different types of therapies, but no one has ever done the Dolphin Stim with the scar tissue release and the vagus nerve along with cranial work. And she feels like that was the stepping stone for her. And she recently went on a very long trip, and her fear was that she wasn't able to walk. She went to Fatima in Portugal, and so she had to walk a long time. And so she just got back from her trip a week ago. And I said, how did it go? She said, I was totally fine. I had no pain. She had walking sticks. And she said, it was so wonderful. I just couldn't believe it. So that's the power. And I think the power of the testimonials in the case studies say everything. And what I like about the Dolphin Stim and your website is this isn't like a fad or a new thing. It's been around for a while, and there's a lot of research that you have done and some of your trainers have done and people in the medical field. So there is like living proof of real case studies that this is helping.
It's got a surprisingly strong evidence-based science. Unfortunately, the evidence-based science is in a different direction than everybody's trained. So the difficulty seems to be, and once again, you heard it through a colleague, is trying to get the therapist from focusing in the CNS, PNS, and to turn their heads and look more into the autonomic nervous system and its role in terms of this myofascial that we see every day, and that its role in there is much stronger than we were ever taught in the school. Don't you agree? You know?
Oh, absolutely. I mean, I never learned this. I mean, granted, I went to PT school quite a while ago. I mean, things were very different over 30 years ago, but I don't remember. I mean, I learned some, you know, the PNF stuff, and we certainly talked about central nervous system, but not to this depth at all. Truly, I think it's the missing link, you know. A lot of times what I see with craniosacral therapists, it's a powerful thing, but I think this in combination with the Dolphin stem there's a lot more carryover. I mean, I'm seeing personally much longer results. I mean, like this guy from 2-3 years ago, he's still feeling great. A lot of times, I'm sure, Dr. Bruce, you've seen, with people who are chronic, it's sometimes a challenge to break that cycle of this, what's happening in the nervous system. And I think, like I said, I think that's the missing link. And I use the Dolphin stem with every person. And I like to use it even before I start any treatment to do the parasympathetics, the points on the wrist, just to calm the body. Or perhaps if they're in high anxiety, I'll do the vagus nerve and then do the cranial work. Absolutely, because I have worked in the traditional field and I know what it can be like. It's a busy place. Sometimes therapists are seeing, unfortunately, quite a few people simultaneously. And so I think this would save a lot of time, because if you start to use this Dolphin, it doesn't take an hour to use the Dolphin. I mean, sometimes you can just do someone's wrist point and have them come down a notch, or you could be doing the vagus nerve stimulation while you're stretching them or doing other things with them. So I think it's huge. And in fact, sometimes it's hard, I think, speaking from when I was a traditional PT, to kind of look outside the box. Because if we're looking just at symptoms and being a pain chaser, we're really not benefiting the client or their possible outcomes. So I'm prepping I have a colleague friend, we've been PT friends for a long time, and she has a great traditional clinic. She does a lot of sports medicine type of thing. And so she sends me a lot of her clients. She said, can you do your thing with the Dolphin and your scar tissue thing? And I'm like, sure. So a lot of times I do my thing and then I send them back, because I don't have fancy machines in my office or any of that kind of, green turf, jumping, all that kind of stuff. So I send them back, and we're finding as we're co-treating, we're getting really good results, the two of us. She's happy to send me this. She just doesn't have time in her life, unfortunately, to train for this. Right. Because she has a really busy clinic. So it seems to be working fine if I have other therapists actually sending me the clients, and then I send them back so they can, do their strengthening or whatever needs to be done. But I really think it's an important issue to have, to kind of bring the awareness to the community, to physical therapists, so they know that this is out there. Because I have seen my clients come into me and say, I tried 10 visits or 12 visits with a therapist, but I just didn't get the results that I wanted. And I think this may be the reason why. I mean, I think we have to look at the body as a whole, and not just looking at, okay, you got back pain, let's look at your back. There's a lot more to back pain than just looking at the back, right? Oh, absolutely. Absolutely. And I treat a lot of C-section scars too. And the number one question from my clients is, why didn't my surgeon tell me about this scar? So it kind of, surgeons don't have a lot of time. But I think this is something that even physicians need to know about, especially surgeons, that this is something that needs to be done like really fast. Absolutely. And I think possibly an answer to that issue is when we, as practitioners that are using the Dolphin for scar tissue release or other, chronic pain things, I document everything. I document my results. I have a lot of case studies. And when the person goes back to their surgeon or their physician and sees that the person has minimal pain, they're back to their activity level, and their scar looks very different, I think that is key for physicians to see so they can say, oh, wow, this really works. It's hard, and it's like trying to get the word out there. Like, for example, my husband had cardiac surgery about 20 months ago, and I used the Dolphin pretty much like a week after his surgery. And I shared on our Facebook page his before and after. And I didn't do it only for cosmetic reasons. He's a very good golfer. And we do a lot of cycling together. We have a very active life. I was concerned that he might lose motion too in his trunk and shoulders and also affect his core stability. So I did it for a multitude of reasons. And it's funny, I was doing that when we were living in Naples, and we had 3 other friends in our neighborhood who had similar surgeries. They're knocking on my door. Can I have some dolphin juice? But I'll tell you, my husband, when he went back to his surgeon and also his cardiologist, they wanted to look at his scar, and his cardiologist is like, well, never seen a cardiac scar like that, like 6 months post-op looking like that. So I went with him on his appointment, and we started talking, and the cardiologist is like, can you give me some information? And I'm like, sure. So I sent him some information. And so, I mean, it's little by little, but it's hoping that, more people and more doctors see that. And it is a slow process, unfortunately, because I don't market to doctors ever because they're so busy and they don't really have the time to chit chat about different modalities. But I think when they see the results, I think that's power in itself. And I just wanted to share like one last note. I had lung cancer in 2014, and I had my right middle lobe removed, and I had several scars from that surgery. And so I'm cancer-free. But what happened was, this is before I knew anything about scars, really. I started getting 3 months post-op. I had such a severe frozen shoulder. All of a sudden, I couldn't wash my hair. I couldn't put a coat on. I couldn't move my left arm. And I'm like, this is really weird. And what I discovered through working with another practitioner who was not a dolphin person, but she knew a lot about scars, my left frozen shoulder was due to my right lung cancer surgery. So that's the power. I mean, you could have a scar in the right side of your lung. It could affect your left hip, so that's something that I think people really need to know. It can affect any part of the body, even if it's distal. Well, I do have movement assessments that I do. But the other thing that I've been trained in, I'm not sure if you're familiar with this neurokinetic therapy. It's a form of muscle testing. Yeah. And one of the things is powerful is with the scar, we do different muscle testing, and it's not your traditional muscle testing. Last week, I had a woman who had a C-section scar, and just assessing her single leg stance, standing on one foot, she was all over the place. And I said, you know what? Just enlighten me. Put your fingers on your C-section scar. And she did her single leg stance again. And she was really good. She's like, wow, what's up with that? I'm like, your scar is influencing your balance. It's really interesting when you do that kind of assessment with someone, they're floored. So this brings an important matter with traditional PTs. Instead of just starting someone on, exercises and core stability and all this stuff, if you do not assess the scar, you will not strengthen the core. You will not have core stability. So I see it all the time. People say, oh, I go to the gym and I do this with a ball and I rotate this and I'm working my core, and then I test them and they got nothing. Thank you for having me. I could talk all day on this, and it's just such a a wonderful tool, and I just hope more people discover it and start to integrate it.